Good evening and welcome to Sweet Blessings, the Anna L. Brothers Show and Podcast, where we come to you every Wednesday to inspire, to encourage, and to empower you to live a healthier lifestyle. Well, I'm Anna. I'm a retired school teacher. I'm a jury consultant. I'm an author. I am a health consultant, and I'm a certified cake instructor. And so the purpose of the podcast is to make people more aware or to provide knowledge for the well being of the whole individual. And so we provide knowledge, workshops, and speakers to come on and talk about certain topics. And so it's really all about ordinary people doing extraordinary things. And so this evening, we are going to be talking a little bit about insurance. And so I have a special guest that is going to come and speak to you on the Affordable Care Act. It is, I guess, better known as Obamacare, or however. But sometimes you might not know all of the facts or the knowledge or anything as of that. And so, my question to you before we begin, because this is just really basically about, I think it's a health reform bill. But sometimes you need to ask yourself, well, why is insurance important? And I'm going to give you a few little um, facts on that before we break into a commercial. And then when I come back, I'm going to bring on our special guest. So I think that insurance offers us financial protection from unexpected things or like that. It also helps with risk management. Um, Whereas when you have the certain disasters or unexpected things, the insurance company will take care of it as opposed to of you taking care of it. That's what I mean by risk management. And then it gives you peace of mind. That gives you peace of mind. So you have to worry, you don't have to be worried about all those expenses. And then legal requirements such as a lot of them when you buy an automobile, it requires you to um, have insurance before you can even take it out the lot. So there are some legal requirements to insurance. Business continuity. Uh, so most businesses have insurance. For a reason, for no loss or whatever, investment and savings. And also, it offers economical stability. So, with that being said, I just want to remind my Facebook watchers that you can support me by sending stars. Stars help me earn money to make more content. And so I am also on Facebook. I go live on Facebook three times a week. This is being streamed as we speak, and you can reach. That is my Facebook there as well. And then also, I am. If you want to get in touch with me, because I do have guests on from time to time. I try to have a guest each month, and so if you're interested in that, this is my website. It is a bit, but you can contact me there. You can set up even if you want to be a sponsor or something on the show to advertise or do something like that. You can also contact me at that location there. But you can also contact me through my email, and this is my email. So if you have any questions or anything like that, by all means, reach out to me on my email. I'll be glad to get back in touch with you with that. And then the last thing that I want to leave you with is my YouTube channel. I'm trying to build my subscribers, so if you could possibly subscribe to my YouTube channel, and that is it on the bottom of that. And so now what we're going to do is we are going to leave out of here and take just a brief little commercial break. And then when I come back, I will introduce our special guest for you.
Join the She Trucking Foundation today and be a part of a supportive community of women in the trucking industry. Unlock exclusive access to valuable resources, including mentorship, educational workshops, and networking opportunities. Whether you're an experienced professional or just starting your trucking journey, She Trucking is here to empower you and help you thrive. Visit www.shetrucking.com to join us and drive your trucking career to new heights.
All righty, we are back. We are back. Well, I am going to bring to the stage Miss Maddie Telefarrell Patterson. And she is going to, I want to say thank you and welcome. And thank you for agreeing to be on the podcast show this evening. And I just want you to tell the audience a little bit about yourself.
Hi. So I am a resident of the state of Arkansas. I have been in the insurance industry um, well over 30 years. The first 20 years, I worked as in property and casualty insurance, and since 2015, I've been working in the healthcare insurance industry. I have two children, and looking forward to retirement very, very, very soon. And and I am
But I know you go fast. Something else to do. I already know.
yeah, I'm hoping not, but you know how
Yeah.
it is. And I am also a licensed health insurance agent for the state of Arkansas.
Okay. All right. So you're
Okay.
gonna give us a little thing. So can you kind of tell us a little bit about what is the Affordable Care Act and its goals?
Okay. The Affordable Care Act is actually the bill that was put in place is actually called the Patient Protection and Affordable Care Act. And most people refer to it as the Affordable Care Act or ACA for short. And it is the comprehensive health care reform law that was enacted in March 2010 by President Barack Obama. And the purpose is to increase health insurance coverage for uninsured people and implements reforms to the health insurance market. The goals of the Affordable Care Act basically is just to make sure insurance is available to all individuals. Um, this when you on the Affordable Care Act, the law also incorporates what they call subsidies to help you pay for your insurance. So the government, if you will give you some money to help you pay for your insurance. So you pay some, they pay some. Then that's where it kind of makes it more affordable for you. And it's also works with the Department of Health and Human Services. And what they do is they through that program, it also allows those who are below the federal poverty level, and it is a financial guideline that's set in place by the Health and Human Services. And based upon that, there are people who may not earn a lot, but they do work. And
Mhm.
this way, they are also able to afford insurance. And it is better known as the Medicaid expansion. Every state doesn't have it, but many states do.
Mhm.
And it's just very an easy way for people who are not offered insurance through their employers, it's a good way for them to obtain health insurance.
Okay. All right. All right. So let us do. We're gonna do another little break for a commercial, and then I'm gonna come back and ask you another question.
The Homeschooling Interactive magazine is a magazine that embraces and celebrates the entire homeschooling experience. Our magazine is different from all the rest because we provide beneficial information and assistance in homeschooling, business, wellness, mental health, resources, and life. We encourage you to pick up a copy of our magazine today on Amazon.com by simply searching the Homeschooling Interactive magazine. The Homeschooling Interactive magazine is all about impacting the world through home-based learning, helping to de-stress the homeschooling experience. Get your copy from Amazon today.
All right, we are back, and we are with Maddie Teleperry Patterson, and she is going over the Affordable Care Act. And I'm glad because I really I knew that it helped people, but I really didn't know all the logistics of it. You know what I'm saying? And so this is also an opportunity for me to learn as well. And I always tell my audience that even though I do the research and I do all that, I always learn something um, new that I just did not know before. So my next question to you is, what are the requirements for this program?
The requirements to get insurance on the Affordable Care Act are, um, it's not a long list. First and foremost, you have to be a resident of the United States. If you are not born here in the United States, you can. If you've lived here for a certain number of years and you have your naturalization card, you're eligible to get it. If you are here on a school visa, some work visas, there's a long list of eligibility requirements, but those are usually the top 3 or 4 requirements to be eligible. That's one. The next requirement is that it's based on the families, the size of your family. That's the number of people in your family that you're going to be claiming on your income tax, as well as your annual household income. And that is for those that are working in the family who's going to be claimed on the taxes. So if it's a husband and wife and you have some children, you're going to claim that they're working. All that's going to be considered as part of the household income. That is used to determine some of the eligibility for the insurance as well. Um, and after that, for those that are at the federal poverty level, you
Mm-hmm.
can also qualify. And again, it's going to be being a resident of the United States, have a naturalization card, work visas, and such. But your program is just a little bit different, but you still are afforded the insurance, but it's just going to be based directly on your income versus the income and family size on the Affordable Care Act. And those guidelines, again, will be given to that person through the requirements that are put out by the Department of Health and Human Services.
Well, is there a specific requirement for seniors, or is there an age? Um, when they become a certain age, something, do they incorporate them in the plan as well?
So for age, it is eligible for anyone uh, in the United States as a legal resident, citizen, what have you, that are age 64 and below.
Okay. Okay.
So if you're 65 and over and you are here in the United States, and you've worked the 40 course, you may be eligible to get Medicare. However, there are some people who have not been here and have not met the requirements. So in
Okay.
certain circumstances, you can still get on the Affordable Care Act, but your uh, requirements going to be a little bit different,
Okay.
and there is a thing that the money I was talking about earlier that helps you pay for your insurance.
Mm-hmm.
If you are not in that category, but you're 65 and you can't get Medicare, you never paid into it, then you're going to pay the full cost of that plan. You won't get any assistance to help you pay for the health insurance.
Okay. Mm, that's interesting. Okay. All right. Well, we're gonna come back. I'm gonna go and do another commercial. I gotta absorb a little of that. You know what I'm saying? Of what you said. And then I'm gonna come back and ask you about. I know since you work in this that you've heard some criticism for the health for that plan. So I want when we come back, I want you kind of just briefly go over some of the criticism or some of the drawbacks of the of that um, of the plan. So we will be right back.
Well, you have any closing remarks before we head out?
Y'all, please support the movement of CTR Media Network. I'm telling you, being a part of this amazing media family, I can't go wrong, right? They have the support. They support us in all that we do. If we have questions, they take the time out to advise and mentor. So definitely check out the different plethora of shows that are on the network. I promise you, and I'm not saying this because I'm part of the family, but I promise you, you will be uplifted, inspired, educated, motivated, all the good stuff that we all need to carry ourselves out through the day. So definitely go check it out, y'all.
Awesome. I definitely appreciate it. We definitely appreciate it.
Okay, we are back. So you had time to think about that little question. So, what do you
And
think?
then,
Go ahead.
I did want to include that if anyone is 65 and older, you should actually consult Medicare.gov or contact your local Medicare agency if
Okay.
you are seeking information further on getting any kind of insurance, and they'll be able to guide you best there.
Okay. Just Medicare, or should they also contact the other one too? Let me see if I can put Medicare.gov on here.
It would be best to start at Medicare.gov
Uh-huh.
or contact your local Social Security agency. They'll be able to best give you the information that you need if you fall into that age group.
Mm-hmm. Okay, I think I got this here. Let's see. All right, so there is Medicare.gov, so you can contact that if you're 65 and older. That's what you're saying. That would be the a good
Yes,
starting point for that. Okay. All righty.
yes.
So now my question before we went to break was, what are some of the criticisms for the health reform program?
Um, well, so some of them are it's been said that many people have to pay higher premiums. Um, others, you can. So I guess the biggest ones, you can be fined if you don't have any insurance. Uh, Taxes go up based upon because of the ACA or the Affordable Care Act. A lot of businesses cut their employees because it says if a business with 50 or more full-time employees must offer insurance or make payments to cover the health expenses for employees. So a
Mhm.
lot of them don't want to do that. So therefore, they will reduce the hours, of course, and then that actually falls back on the employee. Running into financial situations because the hours have been cut uh, due to that main circumstance.
Okay. Um, I did a little research. Let me see what they're also saying. Um, uh, it's saying that the people in the workload and the cost for medical providers, um, they have longer hours and shorter. Um, they have largely fared worse from higher health care costs for the medical providers as well. So I don't know, maybe I don't know what that's all about, but they have that one up under the criticisms as well. And then it also says that some of the doctors refuse to take patients who have the ACA because of the lower payment rates. That was one of the. I know you wouldn't even know anything about that, but
All of that comes on the back end.
yeah, that's what I'm saying.
That's more.
Yeah,
That,
I
yeah,
know.
that's probably some this doctor's probably saying, "Oh, the
Yeah,
doctors would know more about that than I
yeah,
would."
yeah, that's what I'm saying. But this was some research that they had did about. They have what you have on here as well. That they would cause the taxes to increase, and all those things that you said. But those are the two. I would never think the doctor's not wanting to use the plan. But like I said, when you go through, you do this stuff, you do realize you learn some different things. You can see a different perspective of some of the
Hmm.
things. Sometimes I must say so
I
myself.
haven't
So
ran into a doctor yet that doesn't want to. Yeah, I
I have,
haven't ran into a doctor yet that doesn't take the insurance. So that's something new. I've never heard that one.
yeah, what I just, can you imagine though? I just can't even imagine that. What?
I
Okay.
can't either.
So, but anyway, I'm looking at this research here, and this came from Forbes, Healthline, Forbes.com, Healthline.com, Urban.com, uh, and all that. But we talked about the criticisms and all of those things. What are the benefits of it?
Well, I think to me, the most important benefit is now everyone can get health insurance. I know when I first started working in the health insurance industry, I was very surprised at how many people did not have the insurance, but now were able to afford it. And the biggest reason why they didn't have the insurance was because uh, they said it costs way too much, and most of people could not afford it. So I think that's one of the best. To me, that's one of the best ones. And then the second is that now there are no pre-existing conditions. So you can years ago you could get health insurance, but they didn't have to take you if you had, say, broken leg 3 years ago. They don't have to take you, or if you had a tumor or heart attack, last year before, they don't have to allow you to get the insurance. But now you can get the insurance and none of that matters. And I think that's very important. And I believe it's a driving force for people now to go ahead and try to get the insurance, because none of those things matter. Um, Many years ago, there used to be what they would call a lifetime cap on some plans. So you could have a service for so many, have a situation, and I'll use cancer because that's a more common. And once you reach that maximum dollar amount that the insurance company is willing to pay for that cancer treatment, then you're done. This way,
Mhm.
you don't have any limits with any of that. It's just you just go into you can go into your healed. You don't have to worry about any of that happening to you. And then it also covers more health screens for you, so you can get your annual physicals. It covers preventive in, immunizations for you. Uh, Children can also have all those things covered, so your well woman, your well man, if you will, exams, all those things are now covered for you, and you don't have to worry about getting those uh, outside. And then now they also are special requirements. So if you have situation is hereditary and it's in your first immediate family, and there's testing available for it, those people can be tested as well, but also covered. So many years ago, they had that, I believe it was that you had to be 50 or so to get a colonoscopy. But if you had a history of colon cancer and it was like from the mother, father, or somewhere there, and then you had a child or a child or sister or brother, now they can be tested as well, to see if they would be prone to having that same situation. I'm just using colon cancer. It might not be the right one, but I know that
Well, you
I know
know that.
some things, some
Yeah,
things that are genetic, you can't be tested for it, even if you're
I
not
don't
of
know if
age.
they
They're not
genetic or
allowing
not,
that.
but my aunt had colon cancer, and she because she had colon cancer, it made all of us had to go in, the whole family, everybody had to go in for colonoscopies and stuff. And then I was young then,
Hmm.
back then. So what you're saying is basically true, you know, because we all had to do it, even the guys, everybody.
Hmm.
So,
I do know it is true with people that have breast cancer.
mhm,
And if it's a mother father, men do get breast cancer. If it's a mother father sister
mhm,
brother, then the children can also get tested. um, the grandchildren, all that immediate first cousins, everybody's right there in the forefront. They can also get tested before the age requirement. If if like I say, if it's a close family relative in that first generation, first and second generations, I'll say that. And I think the other benefit of it is also that prescription drugs cost a little bit less now than what they used to. And I don't know what I didn't have to take a lot of prescriptions. I was just always a Tylenol girl or get some aspirin and go ahead. So,
mhm.
but I do understand that the cost for those because of the Affordable Care Act, the cost of prescriptions have come down quite a bit.
Okay. Alrighty. So,
And in addition, any of
oh,
this information, you can always just, a lot of it, you can search it A to Z on healthcare.gov. And there's going to be, I believe it said when you get on the website and you have questions, they're like by topic, and you just choose, you type in a topic, or you can go and there's alphabets A to Z. You can click on each alphabet and see if there's a topic there that that you want to cover or want to get more information about, and how the Affordable Care Act provides for it.
okay. Alrighty. All right. We're going to take another commercial break. And then when I come back, I am going to ask you the all important question. What you would like to leave us with, a little, little synopsis of whatever, and what advice we can, take from this about, insurance. And so we're
Okay.
just gonna break for a cute little commercial here. Let's go.
Does this resonate with you? Has a company ripped you off in the past? SettleShark is changing how consumers get money back from companies. SettleShark assists consumers during the entire process, from beginning to end. Our process is simple, convenient, affordable, and powerful. You're in control. We are here to help you. Contact us today at www.settleshark.com or call 1-888-704-0708.
All right, so we're back here, and we have Maddie Talafair Patterson, and she's telling us a little bit about the Affordable Care Act. And I think we have a better understanding. At least I know I do have a better understanding of it as well. But the thing about it, I always ask my guests to what can they leave us with? What advice can they give us? So I'm gonna turn it back over to her and see what she says.
Well, I think of it this way. When you are thinking about your health overall, uh, I think about like this. So when you purchase a home, you buy homeowners insurance for it. And you buy that insurance because you want to make sure that something happens, that it's covered, and that you don't have to pay an astronomical amount of money out of your pocket. So I think of health insurance in the same way. It is always a just in case, because with things the way they are today and cost steady rising, you might not want to believe it, but you go to the hospital, you come home, and you don't have any health insurance. You're sitting there with a $30,000, $40,000 bill, or $15,000 bill, $2,000 bill, 1,500. Now, how are you going to pay it? If you had health insurance, you wouldn't face those kind of large numbers. So I always think about health is just the same thing, just in case.
Well, I would agree with you 100%. You need all kinds of insurance, not just health, but health is very important. Because health is part of self care. Okay, so you need to try to take care of yourself just as you would take care, like she said, just like you would take care of your home. So I do want to thank you, Maddie, for coming on and sharing a little, giving us a little insight into the Affordable Care Act as well. It enlightened me. I'm sure that it enlightened the audience as well. But in uh, closing, I do have some little things that are coming up, and I have some upcoming events. Which after I close, before I close out, I'll show those at the end of the program. But I am going to ask Maddie to just hold on for a few moments, and I'll be right back uh, to you. Okay. All right. So I want to thank everyone for coming on this evening. It has been such a pleasure um, to have Maddie on to tell us about the Affordable Care Act. And um, you really need, like she said, you should contact Medicare.gov or the um, health.gov as well for any information because of the locality of your state, because there are different things for there. And so I'm going to close out. I hope that somewhere in this evening that we have inspired you. I hope that we have encouraged you, and I hope that we have empowered you to live a healthier lifestyle. And so as I close, I always want to leave you with my 3 L's, which is to live your life to the fullest. You only have one. So take that one life and make yourself happy. The second thing is to laugh, and to laugh well. Laugh well. Find somewhere where you can laugh at something, or even laugh at yourself, because laughter is good for the soul. And then the third thing that I suggest that you do is to love. Love with all your heart. And I know it's difficult sometimes because you have people that kind of rub you the wrong way. But my grandmother always said, baby, you can love them. Those are the ones that need the love the most. And so you have to love some people with a long wooden spoon. So I pass that advice on to you as well. But the most important person to love is to love yourself. So remember to love yourself, because self-love is so important. So be very, very kind. You will see upcoming events and the recognition as we close out the program. Have a great evening. Bye bye.